Hi, this is Lois Haggard. I manage the Community Health Assessment Program in the New Mexico Department of Health. This is part 2 of the Community Health Assessment video series. In this video, we will take a look at the meaning of risk. In the previous video segment, we talked about using both subjective and objective information to inform an assessment of the priority health issues in a community. In this video segment, we talk about how we think about risk in public health and how objective information is used to assess risk. Risk is the likelihood of having a certain health outcome. In public health, we track many different health outcomes, including infectious and chronic diseases, injuries, and birth and death outcomes. At the individual level, a person with a high likelihood of having a particular health outcome is considered at risk for that outcome. Risk is the result of all the things that contribute to a person's or community's health status. Their risk is the result of risk factors such as their age and sex, and behavioral factors like whether they smoke cigarettes or exercise. For instance, a person who travels a lot of highway miles is at greater risk of being involved in a motor vehicle crash. In this diagram or model, there are several health factors and health outcomes that we often consider when we assess community health status. Some health factors, such as age and sex, cannot be modified, but they're included in the model because they play a role in individual and population health outcomes. Many health factors, on the other hand, can be modified. Outcomes, like the one shown here, are used as indicators of a community's health status. One of the roles of public health practitioners is to work with individuals and communities to improve modifiable health factors so that health outcomes will improve. We start on the right side to identify health outcomes that appear to be problems and work our way backwards from the health outcomes to identify risk factors we can modify to improve population health. Community risk is the average risk level across all individuals in that community. We use observed rates of death, injury, and disease in the community to tell us about the level of risk in that community. For example, this graph shows some outcome data. These are death rates from 4 causes of death in Bernalillo County, New Mexico. The 4 trend lines show death rates that represent the risk of death from those 4 conditions over time. From looking at the graph, we can see that in Bernalillo County there have been more deaths from cancer and heart disease than there have been from stroke and diabetes. We can also see that the risk of death from cancer and heart disease has been decreasing over time, and the risk of death from stroke has decreased also, but the risk of death from diabetes has been fairly stable over time. Here's another graph that compares 2 different counties on 5 causes of death. Bernalillo County, represented by the pink bars, has a higher rate of death from alcoholic liver disease, while Torrance County, in the blue bars, has a higher rate of death from suicide. Differences like these can offer clues on how to improve health status in these 2 counties. We assess community risk for death and disease because that gives us clues about where health can be improved for that community or population. Instead of trying to modify all risk factors for all health conditions at once, information about disease risk helps us to focus our efforts on those diseases that are most injurious to that community or for which that community has a disproportionately high risk. Looking at risk helps us to allocate and mobilize resources where they will do the most good. In summary, objective information on disease incidents, injuries, births, and deaths is used to assess a community's risk for various health outcomes. It is the job of public health practitioners to look for contributing factors that can be modified to reduce that risk and improve population health. This is the end of part 2. In the next video in the series, we'll talk about data we use to assess community health status and where the data come from.